Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we'll be talking about skin laxity, beginning volume loss, and beginning sagginess. Today, we have a new guest. Let's all welcome Miss Mia. Hi, Mia.
Good morning, Doc.
Yeah. Welcome to CSA.
Thank you po.
And Mia is in her, what age?
43 po.
Wow. But actually, you look a lot younger.
Thank you po.
Okay. So, a while ago, actually, I was doing an assessment on Mia already. And I was discussing with her from the upper third of the face. Okay, this part here from the hairline here, and then the glabellar part or the eyebrow part. Okay, so this is the glabella part. So I noticed already dynamic wrinkles as well as static wrinkles. Right, Mia? So when she raises her eyebrow, okay, you can see those lines, wrinkles. And then when she frowns, you can see also frown line already. Also, I noticed in the mid-face section, so from that line and to this alar tragal line, okay, I also noticed under eye volume loss and a beginning like mid-cheek groove here and a beginning volume loss there. Now also on the lower third, so this is the thing that also Mia is concerned about. So the lower third of the face, actually, if you look at the bigonial width, she has this wider part, okay, making her face squarish, okay, kind of like she was telling me, kind of on the masculine side, okay, and I was sharing with her we can do something about it. And another thing is on the chin region, okay, if you do the 1:2 proportion, she has this shorter chin, and you can also correct that. So a concern on the proportions, a concern also on the beginning volume loss, beginning like ptosis or sagginess, and the last one, the skin quality, I noticed already beginning laxity. So this part is where we do a brief review of our anatomy of the face. Whenever we treat our clients with injectables, whether it be like toxins, fillers, or biostimulators, we need to know what are the different facial layers, okay? So first layer is what we call the skin, which is the envelope. Layer 2 is the so-called subcutaneous layer. Layer 3 is a mass layer. Layer 4 is deep fat or some retaining ligaments. And layer 5 is above the bone or the periosteal layer. So those are specific tissue layers that we need to master also for us to know where to place our filler products, even our toxins or our biostimulators. For today, we'll be showing you biostimulator treatment. So the one that I will be using is the so-called poly-L-lactic acid or Sculptra. Okay, for that part, it's either you place it in the subcutaneous layer or also supraperiosteal layer. But as a biostimulator, we ideally place it in the subcutaneous layer or subdermal layer. Now, for my product biostimulator, the areas where we need to treat will be from the temple region. So you can palpate for the temple fusion line here, and then the lateral orbital rim, and then also we have here the inferior orbital rim, okay, and on this part we have a malar prominence. We also have the zygoma region here, the zygomatic part here, and then as we go downwards on the lower part of the face, okay, we have a so-called ligament here, the so-called masseteric cutaneous ligament, and this part here is the mandibular line already. And in this section, the so-called nasolabial part here, and this one, the prejowl sulcus here. So for my biostimulator, ideally, what we need to treat is the temple region, the anteromedial section, the zygoma region, this part, the preauricular, and then after that, this part, the subzygoma depression here, we can still fill in with our biostimulator as well. And this lower part here of the posterior mandibular region here, we can also inject with a biostimulator, as well as the lower cheek and this anterior part of the mandibular section. the one with the problem of skin laxity, we can also inject with our biostimulator in a subcutaneous plane. So after that anatomical planes or layers, we also have to be cautious with the vascular tissues. So the facial artery comes out from this mandibular notch here. And once it comes out from this, it goes superiorly and medially towards that corner of the mouth to supply our inferior labial part there and superior labial part there. And it courses upward near the nasolabial line. As it goes near that side of the nose, it gives off a certain branch, the inferior alar artery, and as it goes upward, it can give off that lateral nasal until it reaches the so-called angular artery. So that's in the medial section. Now on the posterior part, or rather the lateral aspect of our face, we also have the so-called branch of that external carotid artery, which is the superficial temporal artery. It goes upward here near the hairline section and provides this two branches we call the frontalis branch and also going towards the parietal area. So we can also feel for the pulsation of the so-called superficial temporal artery. Now, apart from the blood vessel, we need to be cautious also with the facial nerve. And facial nerve comes out from this anterior part of the tragus here, and it can give off several branches, specifically 5 branches. Those kinds of structures are in the layer 3 or middle layer. That's why in injecting either filler or your biostimulator, you should know the exact plane, the exact anatomical tissue layer for you to have a very safe injection technique. Now, for the range of products that we will use for MIA, starting on the upper third of the face, ideally, we need to relax the forehead muscles or the frontalis muscles, as well as these frown muscles here, your procerus and your corrugator muscles. So that's for the upper third of the face. Now, going to the mid-face section, we want to also improve the infraorbital volume loss. We can make use of our OBT Restylane products or even a Nasha Restylane product for that part. And the anteromedial cheek, if you want to still do a correction of the volume, we can combine again with Nasha or OBT Restylane products. So, going to the lower third of the face, I will also do a correction of the masseter using our Dysport or botulinum toxin relaxing. And also for the chin part, I can make use of my Nasha Restylane products. Now, the skin quality and the skin texture, we can improve it with our biostimulator, the so-called Sculptra poly-L-lactic acid. We will be injecting that on the outside part of the face, particularly the temple, the zygoma region here, a part of the anteromedial cheek, and also on the lower third of the face, including this part of this jowl area here, or the one with this kind of like lines, and improve the skin quality for Mia. So those are the kinds of products that I will be using for Mia to give her that harmonious, balanced, and aesthetically looking face. For the reconstitution of our Sculptra, so we will be needing 1 vial of Sculptra, a 5 ml syringe, a 3 ml syringe, and a 1 ml syringe. We'll also be needing our lidocaine, our sterile water, and a gauge 18 needle. Now, to mix our Sculptra with the diluent, we have here a so-called Sculptra mixer or shaker. For the start of the reconstitution, so we open the box of our Sculptra here, check for your expiration date of the product, and then open. So we have in one box a vial of our Sculptra, and it has this powder inside. So we need our diluent, which is our sterile water. So we'll be getting our 5 ml syringe here and open it. So initially, I start with preparing my diluent and aspirate initially a 5 ml of your sterile water. So aspirate the entire ampule with sterile water. So I have to complete the 5 ml solution or diluent. So you now have your 5 ml sterile water for injection. Recap it. Then I change the needle with the gauge 18 so I can better insert it in the rubber stopper of the vial of our Sculptra. And then recap it. Okay. So this one, remove the top plastic cover and clean the rubber stopper. So you have an alcohol swab here. So we need to disinfect that opening. And the one that I prepared, this sterile water, 5 ml. So making sure it's in the 5 ml. And then we just insert it in the rubber stopper here. And then push slowly your sterile water onto the sides of your vial. So once you had filled in the vial, you can have this vial of your Sculptra placed in your Sculptra mixer. Ideally, you shake. If you don't have this, you can shake it vigorously for a minute until you see a homogeneous solution there. So the way to prepare this, so snap this stabilizer of your vial here, and then we can just press on this button area here. So for a minute, you wait for the powder to be dissolved in your diluent, the sterile water. So just time it for a minute, and while you're waiting for that 1 minute, prepare the second 3 ml diluent. So do we have a timer? 60 seconds please. Now I am preparing the second 3 ml. And recap it. And I'll use my gauge 18 needle. So this is a 3 ml sterile water for injection. So 1 minute for the mixing to really make the powder totally dissolve and make the solution homogeneous for our injection. So initially it's a 5 ml solution so that we have a space in the vial for the mixing of the powder and the diluent. So 6 seconds, 5, 4, 3, 2, 1, and we're done. Okay, so remove the strap. Now I'll add my second syringe of 3 ml, insert it in that rubber stopper there, and push onto the side of the vial. So this will complete my 8 ml of my Sculptra mixture. Okay, recap it. And again, ideally, the second part, not so much of a mixing, but we can still have it be shaken in this device here. Just few seconds will be enough. While I'm waiting for that, I'll prepare my 1 ml of my lidocaine. So this is optional. We can add another 1 ml of a lidocaine just for the pain control, for the comfort of our patient. So open the metal here. And ideally, I'd still disinfect the cover there with my alcohol swab. And aspirate a 1 ml of my lidocaine. So filling it in. So it's an option to add a 1 ml to 2 ml of your lidocaine. And we can now stop the mixer and snap it and then add our 1 ml. So we can still clean the rubber stopper here. really have a disinfected vial. Now I am adding a 1 ml of my lidocaine, and we can mix it using our mixer here for a final mixing, just to make sure that we have a homogeneous solution here. So just a few seconds more. Okay, and then we can stop and check for our solution. So we have a white solution, homogeneous. It's normal to have a foam on the top layer, and this is ready for injection. We are now at the part of showing you the treatment procedure for Mia. So the concern is the quality of the skin, the so-called laxity, and then beginning volume loss, as well as beginning sagginess. So for our treatment on Mia, we will be using the so-called Sculptra or poly-L-lactic acid. Now, for the treatment of this kind of problem, laxity, volume loss, sagginess, we work on the outer aspect of our face to use, or rather making use of our Sculptra biostimulator. Okay, as to the treatment or injection technique, okay, we make a landmarking first. So we start with delineating the parts of the temple region here. So we have the temple fusion line, and then the hairline here, the lateral orbital rim, and the superior zygoma border. So this is the temple section, and then this is now the zygomatic region here, the zygomatic arch here, and then on the lower part, the pre-auricular region up to the mandibular line there. So we have a vertical line here, a straight line here, as a demarcation of the lateral aspect and that of the medial aspect of the mid-face and lower face section. Okay, so we also have a ligament here, the masseteric cutaneous ligament. For our treatment using our Sculptra, we can cover up the temple region, this anteromedial cheek region, also this inferior part and this inferior part on the lateral aspect, to be able to correct that poor quality of skin, which is the laxity. Okay, so my entry point will be in the zygoma region here. I'll make a red marking there, a red dot, and I will be using the cannula method of Sculptra injection. So for that one, since this is my entry point, I'll make a linear pattern here. It's gonna be a so-called, what we call the fanning technique, and then on the inferior part, I'll be also doing a so-called fanning method also. So this will be my pattern for my Sculptra injection. Now, before any procedure, any injections, we do a so-called cleaning of the area, or disinfecting or sterilizing the region. So we make use of our scleridine or chlorhexidine, as well as our betadine to clean the section. Prior to also doing any injections, you can also numb the skin using your topical lidocaine or your EMLA. Apply it there and then leave it on for about 30 to 45 minutes. So cleaning the area, disinfecting it, removing those markings that we have done. Or you can also spray with some of your disinfecting solutions. For example, you spray, and then you also have your alcohol pad there to totally clean the area. Okay, so since we have our entry point in the zygomatic arch area, ideally I still do a lidocaine injection in the entry point, just to numb the area where we will be injecting our introducer. Okay, so in addition to my topical numbing cream, I also have the so-called pain freeze. We can also spray that pain freeze there, okay, just to numb it. So the section here, I can still remember my marking for my entry point, just a tiny papule of your lidocaine. So I have an introducer or a poker here, which is a gauge 19 needle. So make a tiny opening there, okay, and then have your Sculptra ready. So you have this 4.5 mil here with your gauge 22 cannula. Now I need a sterile OS. Okay, perpendicularly insert it in here, and then we'll just glide it. So I want to improve the temple region. Okay, I'll place it here and then make my fanning method. Okay, start with the posterior aspect there. So glide it in that space. So make sure you distribute an equal amount of your product there. And then a second line there. And then a third line there. And a fourth line there. So this is a fanning method. So after injecting into your temple, we can also correct the so-called preauricular region. So again, insert into that entry point, and then you can go towards your preauricular section. So normal to feel some resistance here, and then push a little bit of the product, and then a fanning method again. So some resistance there because we are near at the posterior aspect of the face, or the most lateral aspect of the face, and then just inject and then inject. So once you're done with the preauricular section, you can also proceed to the lower part of the face. So again, perpendicular, and then go to the inferior part, make your fanning method too. So you can also correct your subzygoma depression in this area. Okay. So a fanning method, and a fanning method, and a fanning method. Make sure you deliver homogeneous or equal distribution of your product so that there will be no lumps or bumps. And you can also correct this anteromedial part here to improve the quality of the skin, as well as correct some beginning volume loss. Okay, towards the mid-cheek groove, distributing the product evenly. Then you can also reach this section here in this superior part of your jowl section to improve again skin quality. And polyl-lactic acid is a biostimulator. It helps in regenerating the skin tissues. It stimulates collagen formation. It activates your fibroblast cells to produce new tissue matrix to improve the skin's elasticity, and as well as improve skin volume and the quality of our skin tissues. So we have done the injection of Sculptra on the right side of the face. We'll proceed to the opposite side. We're now at the part of showing the result to Mia. And Mia, here's our mirror, and you can check on what happened on your face. So look at that, right? So we did a Sculptra treatment for Mia to improve the skin quality, to correct skin laxity, some volume loss, and some sagginess there. And now this is the immediately after the procedure. Mia, comments?
Na-refresh po ako. Pati
Yes.
yung feeling ko, refresh
Right.
din. Kasi
Yes.
kanina, medyo haggard ako. Pero ngayon, I can feel yung quick result po. And I'm
Correct.
looking forward na mas
Further.
gumanda pa po siya mag-improve yung internally.
Actually, with the Sculptra treatment, this is like a gradual improvement. Although after the procedure, we can already see or visualize some change. So what I noticed is like there was an instant like refresh look for Mia, okay? And kind of like a while ago, she really looked so tired, and it was minimized right now. And you'll still see improvements over time. Like usually collagen formation happens like 4 weeks, 8 weeks, 12 weeks. So as time passes by, you will still notice that your skin quality is improving, tissue laxity, volume loss, sagginess, they're gradually improved. Okay, and some are asking how long will it like last. Well, Sculptra treatment, according to studies, it will last 2 years. Okay? So this is like a gradual but long-lasting result. Right, Mia? And you can go back to your work. You're still working later. So this is like a no downtime. Procedure is quick. Okay? And it gives you a very natural result, refreshed, and will make you more youthful.
More confident.
And more confident. I like that, Mia. Okay, Mia, thank you so much for being with us.
Thank you, Doc.
Okay?
I'm so excited to show it to my friends.
Right. And for those who are asking, is the treatment painful? I just remember. Some are asking, is that painful? Okay. So it's kind of like a tolerable procedure. When I was doing that, like manipulation of the tissues, it was fine.
It was manageable
okay.
po.
Yeah.
No screaming, no frowning.
Yeah. And after this, we'll just advise you to do like a massaging to help in the spreading and the even distribution of the product inside your skin tissues.